Welcome to our 5 on 5. Pleased to be joined again today by William North, the CEO of Rogue Community Health. Good to see you. How are you today?
Good, Craig. How are you doing?
Doing very well. So you guys are doing a program that kind of has a social element to medical treatment. Long title, but basically it's known as CASHI. What is this?
Yeah, CASHI is, the title is Collaborative to Advance Social Health Integration. And it's a national collaborative that has been sponsored, supported by the Commonwealth Foundation, which is really focused on healthcare transformation at a national level. And they have a corporation called Health Leads, which is involved in some of the transformative activities related to bringing social and health together to help support the healthcare delivery and outcomes for patients.
Okay, and so how did this come about? I mean, why are you guys looking at this as this is something you want to incorporate?
Yeah, we had been working with the Rogue Challenge for a couple of years now on developing our own case management and intake program. And so this came up as a grant, and we applied for it. And we received that grant with Rogue Community Health, but also partnership with the Rogue Challenge members, where we're able to work with a national group of healthcare delivery systems, accountable care organizations, hospitals, other FQHCs to really work together to develop some best practices in this area.
Okay, and not everyone involved, not all of the agencies are medical professionals, correct?
That's correct, yeah. So from our perspective, we've got other organizations in the human services area. Organizations include Family Nurturing Center, Goodwill, Head Start, the YMCA, as the way that we can begin integrating some of the care that's being provided in a medical clinic, such as Rogue Community Health, with other agencies that are delivering services to the same population, the same individuals, and do it in a much more integrated way.
Oh, interesting. All right, we're going to take a quick commercial break. We'll have much more in just a moment. Stay with us.
Great.
Welcome back to our 5 on 5. Again, we're here with William North, the CEO of Rogue Community Health. So you guys are doing this kind of social element to treatment. Do you foresee you guys possibly converting to this, or is this more of a pilot project?
It's a pilot right now. What we've done is we've begun the process of engaging 25 individuals a quarter to begin testing, creating some of the workflows, those kinds of activities. But we actually see us moving more and more in this direction simply because it's really critical to healthcare outcomes to address the social needs of patients.
Yeah, and I think first thing that maybe comes to my mind when talking about that is childhood experiences, traumas, certainly as a child or as an adult. Are you guys really is that one of the focuses, is incorporating these things?
It is. There's some information around how traumatic experiences during childhood really impacts chronic disease later on in life. And so as we become more focused on some value-based pay, some opportunities to really address some of these outcomes, it becomes imperative that we really address these social determinants. And so adverse childhood experiences really, I consider it to be a foundational social determinant. And the reason I say that is because if someone has multiple childhood experiences that are adverse, 4 or more, then the likelihood of them having chronic disease or life issues later on in life is really significant. So part of what we want to do is be able to address those as we're taking care of people today, but make sure that also their children or others who they may be involved with also get some of the services that they need to address that.
And through this whole project, as a pilot project, as you say, what's the end result for you, or maybe the ideal scenario that this ends with?
Yeah, why we really like CASHI is that it really gives us an opportunity to engage with some national thought leaders on social determinants and healthcare delivery. But the beauty of it with Health Leads is that we have the opportunity to really understand a business case around how you can integrate social activities into the healthcare delivery model. There's some financial technical assistance that's also built in that, which will really allow us to create a sustainable model, one that is financially viable. And then finally, what it really allows us to do is move towards those outcomes that really patients and others in the community really need.
Okay, and so obviously we were talking about kind of Rogue Community Health members. What about people who might be watching who are interested in this but might not be a member?
Yeah, one of the things that we started with in this case management model was the idea of a closed loop system. And so we've got the ability to refer patients, but we also have a feedback loop that really allows us to understand what's happened with those patients. So any of the partners of the Rogue Challenge that an individual enters into this system with can come in and get the additional services that we're providing. So they don't have to be a patient of Rogue Community Health just to participate in the program. Certainly our patients are going to be a priority for us, but we're open to others who might have the opportunity, the need to receive services. I would just suggest it's a pilot. We're developing it, but we really want this to be something that the community can embrace over time.
Excellent. Well, pretty fascinating subject, and I'm glad we got a lot into it.
Yeah.
Very good. Thank you for being here. Appreciate it.
Yeah, thanks, Greg.
Stay with us. We'll be right back.